was blown away by this fact that girls would get their first period around 17 in the 19th century, and now it's around 12, if not younger. Something's really going on hormonally in what we're eating.
That's correct. And we know that a woman's risk of breast cancer and a man's risk of prostate cancer is dramatically affected by the age they go through puberty. When a man gets his beard, gets more hair on his body, when a woman starts menstruating, that the earlier in life that occurs, the higher risk of cancer they have later in life. And that means what occurred to have that become so early, and what occurred is in the first 5 or 6 years of life that caused this early puberty to occur. And that means that what you eat in the first 5 or 6 years of life affects your risk of breast or prostate cancer at the age of 60, 70, or 80. That means there's a tremendous effect. That means that what you eat in the first 5 years of life affects your brain function, your intelligence, your success in college, your choice of careers, your ability to be happy. In other words, so we're saying that what you do very young in life has a long-term negative or positive effect on your health throughout all of your life. And that's why it's not good enough to people eat moderately better. They have to eat an excellent diet to repair some of the damage that's occurred from what they did when they were younger. Also, what I'm saying in the book, and why I'm using the word genocide here, is because what you eat affects the health of your children. And that's not just what you eat when you were pregnant. That's what you ate before you became pregnant. So what we eat in our, let's say, teens and 20s, when we have a child at age 30, that child has an increased risk of autism and learning disabilities because we ate more fast food and processed food. And that child has an increased risk of childhood cancer or brain tumors because we ate processed foods or fast food, not during pregnancy, even before pregnancy. And the medical profession, I'm suggesting, and health authorities are contributing to or exacerbating the amount of children being born with autism and cancer because they're prescribing a folic acid pill to people to prevent neural tube defects. Health authorities tell people, the word folate, and we could check our folate level in our bloodstream to see if it's good or not, The word folate comes from the Latin term for foliage, which means greens and plants, right? Folate is, so a person eating a diet rich in greens, their blood level for folate is usually outside of what's considered the normal range. It's even larger or higher than what's considered normal. It's super high. Folate isn't a nutrient that's hard to find. It's in beans, it's in fruits, it's in vegetables, but it's very high in vegetables. And most people and almost everybody eating healthfully has very high levels of circulating folate in their bloodstream. What the medical profession did is they saw a relationship between very low folate levels and neural tube defects, people not eating vegetables and neural tube defects. And they started prescribing folic acid for people so they can take the folic acid to prevent neural tube defects instead of telling them to eat green vegetables. So instead of benefiting from the thousands of nutrients that are in green vegetables to prevent childhood cancer and other problems that could develop in children like allergies, we just give people a folic acid pill. So now people can get along and think they're okay not having to eat green vegetables. Furthermore, the folic acid is not biologically have the same activity as folate does. It's much more aggressive at being able to penetrate cells and cause cellular replication, and it's linked to cancer now. And folic acid is a major contributor to breast cancer and prostate cancer and other cancers. So the person that's taking folic acid in their pregnancy is increasing their own risk of breast cancer, the increased risk of breast cancer in their children, and the fact that it's a permission slip encouraging them to no longer have to be careful about their diet and the consumption of vegetables, and with the consumption of the folic acid is increasing their child's chance of developing cancer in their future or even being born with a childhood cancer. So it's just, it's insane. We have insane health authorities dictating crazy behavior.
I'm so glad you brought this up today. We're working on this whole conception game. We're planning a baby for 2018.
Right.
We're fairly neurotic, clean about our diets, and we learn from book like yours, and we continue to learn. And we took actually a trip to Thailand to a health center over there where we were potentially going to be hired a few years ago, and we were called the goats for how much greens we would eat. We would take over the salad bar, and the greens would all just disappear, and they'd refill, and it'd disappear, and it'd refill, they'd disappear again. But my wife just ran out of folic acid a month ago, and she said, we're not pregnant yet. Should I stop taking the folic acid? So it sounds like folic acid out. What should she be eating?
Yeah, why should she be taking folic acid, which is a magnification, more powerful version of folate? It's a petroleum product, synthetic. It doesn't exist in nature. So it's not like native folate. So she's eating a healthy diet. Her blood levels of folate are already high, even higher than the normal level. And now she's taking a substance that's synthetic to push her levels dramatically even higher. It's dangerous. Her folic acid supplement is dangerous. And all these fortified foods have folic acid in too. The soy milk has folic acid. The nutritional yeast is loaded with folic acid. All synthetic folic acid, not naturally occurring folate. Remember, as I'm saying, folate is the natural compound. Folic acid is the synthetic compound. So a woman who's eating right, taking folic acid, is increasing their risk of having a problem in themselves or their children. A woman who's eating right doesn't need folic acid. A woman who's not eating right should be encouraged to eat right, not to take folic acid, because folic acid isn't going to do what eating right can do. Mm-hmm. She needs to and she has to be eating right before she even starts conceiving a baby, because neural tube defects occur in the first 12 weeks after conception. So the time they start taking the folic acid pill, it's usually too late anyway. This idea that folic acid is the answer instead of high folate containing foods, it's what's so destructive to the fabric of our country and killing and causing an increasing cancer and childhood problems, including autism. And the consumption of folic acid in pregnancy by the mother increases the risk of the child being born with autism.
Wow.
So this is really some serious things going on.